Preparing to quit. Preparing to quit is one of the most important decisions that a smoker can make. Preparing to quit involves changing your environment, which means getting rid of all triggers. Triggers include cigarettes, cigarette butts, lighters, ashtrays, and also not being around other smokers helps. Changing your environment also means changing the rules of smoking in your car or your home, which may mean not allowing anybody to smoke in your presence. Changing your environment also means cleaning your house thoroughly, the drapes, the carpets, the furniture, and also checking coats and drawers. Also, plan ahead to avoid any temptations. Avoid being around other smokers if at all possible. Also, think about feelings in situations that might give you the urge to smoke. Ask yourself, what could you do instead? Also, something to think about when you are thinking about preparing to quit is the cost of smoking. The cost of smoking is pretty expensive. One pack a day usually goes around for $6. Quitting as hard as it is, we really encourage you to reward yourself by thinking about how much money you can save by quitting smoking. For example, 1 week of not smoking, you can save $44, which is one full tank of gas. 1 month of not smoking is $188. That's healthy groceries for 1 month. 6 months of not smoking is $1,146. That's a gym membership for 2 years. 1 year of not smoking is around $2,292. You can buy a refrigerator or another large appliance for your home. 2 years of not smoking is $4,584. You can take a nice family vacation with that. 3 years of not smoking, you can save $6,877. You can pay off credit cards or any large debt. Finally, 4 years of not smoking is nearly $10,000. You can buy yourself a used car or pay off your existing ones. The cost of smoking is very, very expensive. These are some tools and tricks to help you to prepare to quit.
Quitting smoking can be very challenging. Some people elect to use a quit smoking aid like nicotine replacement therapy or pharmacotherapy. Quit smoking therapies can be used to help curb withdrawals when they happen as you begin the quitting process. NRTs, or nicotine replacement therapy, are used to replace the nicotine that you get from tobacco without all the additional chemicals found in cigarettes. The three most popular forms of NRTs are the patch, chewing gum, and lozenge. If you have any reaction or concerns while taking an NRT, or you want additional information, you can ask your doctor or pharmacist about NRTs. The patch. If you choose to use the patch, it is important to apply it to a clean, dry, hairless portion of your body to ensure that you have good contact with your skin, as the nicotine is absorbed through your skin for the duration the patch is applied. It also aids to have a hairless portion of your body, as there will be less pain when you decide to remove the patch. People have reported fewer side effects with the patch than other NRTs. There are three strength options when choosing a nicotine patch. The strength that is best for you, it depends on how many cigarettes you smoke per day. Nicotine gum. If you choose to use a nicotine gum, you would want to use it when you have an urge to smoke. You should chew the gum until you feel a tingly sensation. Then you'll park the gum between your cheek and your gums. You'll repeat this process until the tingle is gone. The chewing gum will release the nicotine and it absorbs through your mouth. There are two strengths for nicotine gum. The strength that is best for you depends on how many cigarettes you smoke a day. The nicotine lozenge. Similar to the gum, you put this in your mouth, but this will dissolve. Because it is delivered through your mouth, the nicotine travels to your brain more quickly than the patch does, and therefore may be helpful in helping you quickly reduce cravings. There are two strengths to lozenges, and the strength that is best for you depends on when you smoke your first cigarette after waking up. No matter how much you smoke, you should use lozenges for about 12 weeks. Pharmacotherapy is the other quit smoking aid people tend to use. It is a term to describe different types of drugs that can help you quit smoking. The two types that we'll talk about are Zyban and Chantix. Using drugs to help you quit smoking is not for everyone, and it is a personal choice. A doctor will have to prescribe you these medications and will be able to go over the benefits, the side effects of each, and the screening to see if you are able to take a quit smoking drug. Zyban. Zyban is useful to help you reduce cravings that you get and can also decrease withdrawal symptoms. These symptoms can be anger, anxiety, trouble concentrating, or restlessness, and feeling depressed or sad. Zyban was originally used as a depression medicine, but it also has a beneficial side effect of curbing cravings due to smoking. Chantix. Chantix is a drug that you can use while you still smoking and making final preparations to quit. It is a very safe drug, but should not be taken by pregnant or breastfeeding. Chantix partially blocks nicotine receptors in your brain and in your body to help you stop cravings of cigarettes. It also helps with withdrawal symptoms when you quit smoking. Most people would take Chantix for 12 weeks. Some people may need to continue an additional 12 weeks.
Cigarette smoking in Native people. Smoking is the #1 cause of avoidable illness and death. Smoking can also lead to other diseases as well as contribute to poor health outcomes. 37.3% of all adult American Indians, Alaska Natives smoke cigarettes. This is over 14% more than any other ethnic group. At the bottom of the slide, you see a percent of people who smoke in different ethnic groups. And on the chart, you can see that American Indian, Alaska Natives are at the highest rates. American Indian, Alaska Native women are the only group of people in the United States who smoke more cigarettes now than they did 30 years ago. You would be shocked to find out all the harmful chemicals that are put into a cigarette. There are over 4,000 chemicals in a cigarette. Cigarettes often contain things that you would not expect to find. We have listed a few items below and also provided a picture of different harsh chemicals that are in cigarettes. To name a few includes nail polish remover, floor and toilet cleaner, poison, tar, car exhaust fumes, acid that's found in rechargeable batteries, formaldehyde, which is known to be used to preserve dead bodies, as well as the chemical that is found in paint thinner. Once you quit smoking, you will feel the health benefits immediately. 20 minutes after quitting, blood pressure returns to a normal level. 8 hours after quitting, carbon monoxide in the bloodstream is cut in half. 3 days after quitting, the ability to breathe is easier. 2 days after quitting, circulation improves and lung function increases up to 30%. 1 year after quitting, the risk of heart attack is reduced by half. 5 years after quitting, the risk of stroke is reduced to that of a non-smoker. 10 years after quitting, the risk of lung cancer is reduced to that of a non-smoker. And 15 years after quitting, the risk of heart attack is reduced to that of a non-smoker.
Electronic nicotine delivery systems. There are many different tobacco products on the market other than cigarettes. Electronic nicotine delivery systems, or ENDS, have become very popular among adults and youth. These products heat a liquid into a vapor that can then be inhaled. The liquid used contains a concentrated nicotine solution. The image on the right of your screen shows some examples of different ENDS products. The health effects of ENDS and e-cigarettes are not fully known. Early findings show that daily use may increase the risk for heart attacks, and it is also possible that ENDS and e-cigarette use can lead to damage to the brain development of young people. So ENDS and e-cigarettes are not safe for youth, young adults, pregnant women, as well as adults who do not currently use tobacco products. ENDS and e-cigarettes have not formally been proven as a quit smoking aid, but they may have the potential to benefit adult smokers who are not pregnant if used as a complete substitute for regular cigarettes. Why do people smoke? People smoke for many reasons. Some of the main reasons people smoke are to cope with stress, for pleasure, to relax, and some people smoke for ceremony or to pray. Stress is one of the most common reasons why people smoke. Things that can cause stress include having a hard time finding a job, living with little money, experiencing discrimination or racism, and the death of a loved one. We will talk more about stress later on in the presentation.
Coping with withdrawal. What is withdrawal exactly? When quitting smoking, you can go through nicotine withdrawal that can cause a wide range of mental and physical effects on your body and your brain. For example, below are some tips to handle withdrawal when you are starting to stop smoking. Drink lots of liquids, especially water. Try herbal tea or flavored water at that. Do limit coffee and soft drinks or alcohol because they also can increase your urge to smoke. Avoid sugar, fatty foods, and don't skip meals. Exercise on a regular basis. Change your habits, such as your environment, your playmates, and your playgrounds. Also get more sleep. Quitting smoking comes with withdrawals. These are common withdrawal symptoms, and we also list suggestions on how to cope with them. For example, if you are experiencing dry mouth, sore throat, sore gums, or sore tongue, we suggest sipping ice cold water or fruit juice. Also chew gum to keep your saliva going. If you're experiencing headaches, we suggest taking a warm bath or shower. Also try relaxation or meditation techniques. If you're having trouble sleeping, we suggest not drinking any coffee, tea, soda, or anything with caffeine after 6 p.m., as this may mess with your sleep. Experiencing constipation or diarrhea, we suggest adding fiber to your diet, such as raw fruit, raw vegetables, and whole grain cereals. Also try drinking 6 to 8 glasses of water per day. If you're experiencing fatigue, we suggest taking a nap. This is a very crucial time. Try not to push yourself so hard during this time. If you're experiencing hunger during this time, we suggest drinking as much water as possible or any low-calorie liquids. Eat low-fat foods and low-calorie snacks. Experiencing tenseness and irritability, we suggest taking a walk for at least 20 minutes. Soak in a hot bath afterwards. Treat yourself pretty good. And also coughing. If you're coughing a lot, we suggest sipping warm herbal tea with honey and lemon, or suck on cough drops or hard candy.
Traditional tobacco. Traditional tobacco is tobacco and or other plant mixtures grown or harvested and used by American Indians and Alaska Natives for ceremonial or sometimes medicinal purposes. 5 traditional tobacco uses that are common including honoring and welcoming guests, blessing food crops, for prayer, for purification, and also payment to elders or healers. Sometimes you give traditional tobacco to people to talk for you or to advocate, in the spiritual world for you. Traditional tobacco preparation and use varies across tribes and regions. There's been somewhat of a misguided notion that smoking cigarettes is tradition or part of our culture. There was a point where commercial cigarettes and commercial pipe tobacco kind of made its way into our ceremonies. And that's where some of the problems kind of began. We feel like where smoking cigarettes was part of tradition when it is not. The traditional tobacco, organic traditional tobacco that is grown by our people doesn't have all the toxins or all the things that can make you sick. So our program hopes you're able to recognize these differences and to respect the tradition of tobacco by not abusing commercial cigarettes and other forms of the commercial tobacco products.
The best way to reduce stress is through relaxation. There are many different relaxation techniques, and it is best to see which works best for you. There are also traditional activities that can help reduce stress. Some relaxation techniques include deep breathing and muscle relaxation, exercise, yoga and meditation, and then there are some traditional activities including beadwork, quill work, pottery, and other types of art, playing folk music, dancing, storytelling, sweat lodge, and attending ceremony. The best way to reduce stress is through relaxation. There are many different relaxation techniques, and it is best to see which works best for you. There are also traditional activities that can help reduce stress. Some relaxation techniques include deep breathing and muscle relaxation, exercise, yoga and meditation, and then there are some traditional activities including beadwork, quill work, pottery, and other types of art, playing folk music, dancing, storytelling, sweat lodge, and attending ceremony.
Weight management during smoking cessation. Many people worry that they will gain a lot of weight when they quit smoking, but fear of gaining weight is never a good reason to keep smoking. The average weight gain is between 6 and 8 pounds. 10% of people who stop smoking gain 30 pounds or more. Nicotine makes you feel less hungry. So when you quit smoking, you may feel a bit hungrier than usual. This feeling will usually go away after a few weeks. You also tend to eat a little more. When you quit smoking, people tend to eat more high-fat, high-sugar snacks and also drink more alcoholic beverages to sometimes replace the void from smoking. You're also burning calories at a normal rate again once you quit smoking. Smoking cigarettes makes your body burn calories faster. And after quitting, the body will return to a normal rate of calorie burn. So the best thing you can do is to plan ahead and to keep your body moving and staying physically active. Eat whole foods like lean beef, chicken, and pork. I'd make sure half your meals are fruits and vegetables, a wide variety of fruits and vegetables. You want to limit or completely eliminate sugar if possible. It's hard because we all like an occasional sugary snack, and that's fine, but it shouldn't be every day. It should maybe be once a week or maybe even twice a week. So limit sugar intake that you usually get from soda pop, candy, packaged rolls, and cakes and cookies. This is where you can really make a huge difference by really cutting back on your sugar intake. Instead, you eat more fruits. Get physically active. Begin slow if you haven't exercised much lately. It's recommended to get at least 150 minutes a week of moderate exercise. So moderate exercise is things like walking, maybe even riding a bike at a leisurely pace, and also some gardening. Some of the more intense exercises you can do less of, but it's important to stay active, find things that you enjoy, and find things that you will consistently do. I wanted to point out that lifting weights can be so beneficial. A lot of people will run and run and run. And sometimes, even though that's a great activity, it can sometimes lead you to want to eat more. So some of the latest research has shown lifting weights, resistance training, building muscle is going to help your body stay healthy and also burn calories at a higher rate with more muscle. Try eating, another thing as a culturally tailored program, try eating more traditional foods. Buffalo, deer, wild birds, some of the wild greens. The best thing to do is to stay consistent with what you're eating, stay consistently eating healthy, and try to stay active.
Support from the people around you when you're trying to quit smoking is very important. Friends and family can provide encouragement, distraction, humor, and warmth when you need it. They can sometimes make it easier or harder for you to stay quit by putting you in situations where you may feel more or less likely to smoke. Make sure you pick the right folks to support you. You want people that'll stay in your corner and that'll be there when you need them. It's also important to think about how your smoking impacts the health of your friends and family as well. Quitting can help your loved ones from being exposed to secondhand smoke. Secondhand smoke causes 7,330 lung cancer deaths and nearly 34,000 heart disease deaths in adult non-smokers in the US every year. Children of smokers are also at a higher risk of bronchitis, pneumonia, asthma, respiratory distress, increased ear infections, and colds. Unfortunately, not everyone may support you while you're trying to quit smoking. Don't let these people who don't support you stop you from doing what you want to do.
When you quit, quitting is a major accomplishment. Quitting takes strength and commitment, and you can do it. Staying quit is an ongoing battle, so plan ahead, avoid triggers and old routines, and reach out to your support. So what happens if you slip? It's okay. Staying quit may take several attempts. Most important thing is to get back on track.